Hello students, welcome to the class. In this class we are going to discussing about the role of social worker in healthcare settings as well as what are the functions has to be performed by the trained social worker. Over time, social work function and influence in healthcare settings have expanded significantly in nowadays. In addition to assisting the hospitalized patients and their families, social workers provide genetic counseling, hospitalized services, psychotherapy, and counseling in mental health agencies, and treatment of people with so many disorders also. And substance abuse problems are also need to be addressed by the social workers. It's clear that social worker has to perform a multiple roles while he is working in hospital settings. Social workers specialized role to help patients and their families cope with illness and disability of the patients. We have to work with the patients as well as the family in a different manner. Many social workers in healthcare settings provide patients in their families with counseling and information about the referral to needed resources, example home health care, financial assistance, nursing home, and then placements. Social workers are also skilled in organizing and facilitating support groups for various populations such as cancer patients, rape victims, and patients of seriously injured, impaired infants. They work to enhance the availability of the community based resources such as healthcare clinics in low income neighborhoods, and as well as we have to work with the patients who are affected with HIV/AIDS, advocate on behalf of the individual patients who are in need of services. These are the roles played by the social worker in a health setting. Not only confined to these roles, but also we have to perform funding for lead screening and guidelines concerning involuntary commitment of mentally ill individuals and psychiatric hospitals. Social workers typically function as part of an interdisciplinary team which may include physicians, nurses, nutritionists, rehabilitation staff, clergy or priests or Maulvi, Kaji, and healthcare administrators. On occasion, they facilitate the process through which healthcare professionals negotiate differences of opinion or conflict among themselves concerning specific ethical issues, etc. These are the roles we have to play or we have to perform while we are working with the education institutions. Not education institutions, but health institutions. We may broadly categorize the role of social worker in healthcare settings into counseling, care planning, assessment, advocacy, financial assistance, and legal assistance. Let us look into the matters one by one. First one, counseling. As a trained social worker, we need to counsel the patient as well as the family members, those who are affecting by the diseases or impairment, accidents, mentally disorders, etc. We need to have a rapport, have a empathetical counseling skills to counsel the persons, those who are affected by the problems. Then care planning, not only giving the counseling but also we have to plan care or what is the need of the patients as well as the family should be addressed in the proper manner. What is the necessity? How the care should be delivered by the hospital, and what is the placement should be made by the social worker to the different categories of the patients. Then assessment. If time permits or the time demands, we need to visit the homes of the patients and the family members to assess the situation, assess the condition of the patient as well as the problem to reduce the intensity of the problem by analyzing the situation with the proper methodology like using the home visit tool. Then advocacy. Suppose a person is victim from the rape incident, we need to give legal assistance by advocating with the negotiating with the higher authorities of the system or the judicial system. We have to advocate for the persons those who are victim by the rape attempts. Then financial assistance made by the different agencies, not by the social worker. Financial assistance means we are not supposed to give our own money, but we have to search the new avenues to receive proper funding for the persons those who are unable to pay the hospital fees, like NGOs, philanthropies, sponsors, etc. Then legal assistance has to be given by the social worker only for the persons those who are affected by the incidents, conditions or any hazardous incidents happens in the factory, as well as the road accidents, rapes and violence, etc. It may be communal rights or any internal violence also be. These are the things we need to play while we are working with the health settings. Then what are the functions made by the social worker in medical social work or healthcare settings? Counseling the patients and his or her family members with the proper methodology. We need to build a rapport, or we have to work like a link between the institution as well as the patients. Development of the medical social program with the medical institutions. We are supposed to conduct medical social programs with the support of medical institutions. Participation in the development of social and health programs in the community. We are working like a social educators, social health educators. While we are playing that role, we have to participate in the development of social and health programs in the community. We have to conduct medical social research. We will create knowledge with new things, new thoughts in the situation. What are the roles played by the social worker in a better manner? Because of that, we need to acquire new knowledge. We have to acquire, we have to create new knowledge, and we have to test the created knowledge. We have to assess, we have to come to the conclusions. Because of that, we need to conduct social research. Then influencing and guiding patients in carrying out and in completion of treatment. We have to influence the patients what is the necessity of taking this treatment for betterment of the condition. We have to influence and guide the patients to carry the completion of treatment. Arranging for supplementary care of patients. After the completion of treatment, we have to arrange a situation or environment, or create an environment where the patient can take care himself or herself by utilizing the supplementary care from given by the NGOs or any other things. Educating the patients in regard to his physical condition in order to get better cooperation. Suppose a person met with an accident, he lost his legs. Then what is the next course of life he has to work? In that condition, we need to educate the patients in regard to his physical condition in order to get better cooperation from the family members as well as the friends, relatives, etc. Providing emotional support to the patients and his family. A disease or an accident or a victim or a situation make persons helpless. In that situation, we have to provide emotional support to the family as well as the patients who are met with bad condition, bad situation. Then carrying out purposeful communication with the patients and his family. We need to carry the purposeful communication. We have to convey the information from the hospital as well as the institution where the care, guidance and the support maybe comes to the patients. Because of that, we need to carry the purposeful communication with the patients as well as the family. Providing for the facilitating access to materials and or environmental resources. Suppose a man met with an accident, he is the only breadwinner of the family, but he has lost the leg and wings of the organ. Now he has to rely on his own leg. It's not possible. In that juncture, we need to facilitate to access the material and we have to create environmental resources by utilizing these kind of resources a man could be able to survive and lead as usual life as he is leading in previous years. Referral services has been made to identified by the social worker and has to refer to the patients. Home visits has to be made conducted by using the home visit as a tool to assess the condition of the patient's family and situation. Admission and discharge tasks also be performed by the social worker. In the hospital settings, we have to perform so many roles and functions. These are the main functions which are assigned to perform by the social worker. Hope you understand properly. Today we have discussed about the roles played by the social worker in healthcare settings as well as the functions need to be performed by the social worker in hospital settings. Thank you.